A herniated disc occurs when the inner gel-like core of a spinal disc, nucleus pulposus, pushes through a tear in the tougher outer layer, annulus fibrosus. This can lead to pain, numbness, and weakness due to pressure on nearby nerves. Surgery may be necessary when conservative treatments like physical therapy, medications, and injections fail to alleviate symptoms. Types of herniated disc surgery: discectomy, microdiscectomy, the most common surgery for a herniated disc. A small incision is made near the affected disc, and the herniated portion of the disc is removed to relieve pressure on the nerve. Microdiscectomy is a minimally invasive version using a smaller incision and specialized tools, often resulting in quicker recovery. Laminectomy involves removing part or all of the lamina, the bony covering of the spinal cord, to give more room to the spinal nerves. It may be performed alongside a discectomy. Spinal fusion used in cases where disc removal weakens the spine. This surgery fuses two or more vertebrae together, either with a bone graft or metal hardware, to stabilize the spine. Artificial disc replacement: instead of removing the damaged disc and fusing the vertebrae, a synthetic disc is implanted to maintain spine mobility and reduce the risk of further degeneration. Surgical procedure: preoperative preparation, imaging tests, MRI, CT scan, X-ray, help the surgeon pinpoint the exact location and extent of the herniation. Anesthesia: the procedure is usually performed under general anesthesia. Incision and access: a small incision is made near the spine, typically in the back or the side depending on the location of the herniated disc. Disc removal or repair: in a discectomy, the herniated part of the disc is removed to alleviate nerve pressure. In spinal fusion, the damaged disc is removed, and a bone graft or metal hardware is used to fuse the adjacent vertebrae. Closure: after the procedure, the incision is closed with sutures or staples, and the patient is monitored in recovery. Risks of herniated disc surgery: like any surgery, herniated disc surgery carries risks, including infection, an infection in the incision site or deeper within the spine. Nerve damage: though rare, surgery may cause further nerve injury, potentially leading to worsened symptoms or new neurological issues. Bleeding: excessive bleeding may occur, though it is typically controlled during surgery. Scar tissue may form around the nerve, potentially leading to persistent pain or new symptoms. Failure to relieve pain: in some cases, surgery may not fully alleviate the pain or nerve compression, requiring further interventions. Spinal instability: after disc removal, the spine may become unstable, necessitating further fusion or stabilization procedures. Recovery after herniated disc surgery: recovery time varies based on the type of surgery and the individual's health status, but generally involves hospital stay, discectomy and microdiscectomy. Typically, patients are discharged within a day or two if there are no complications. Spinal fusion or artificial disc replacement may require a longer hospital stay, usually 2 to 4 days. Initial recovery, pain management, post-surgery, pain medication and possibly muscle relaxants will help control discomfort. Physical therapy often begins soon after surgery to improve mobility, strengthen muscles, and reduce the risk of future injury. Movement restrictions: patients may be advised to limit bending, lifting, or twisting for several weeks. Full recovery: discectomy, most people resume normal activities within 6 to 8 weeks, though strenuous activities should be avoided for several months. Spinal fusion: recovery can take 3 to 6 months, and the fusion process can take 12 months or more to fully solidify. Artificial disc replacement: recovery times are similar to those of discectomy, but patients may experience a quicker return to normal activities due to the preservation of motion in the spine. Long-term outlook: most patients experience significant improvement in symptoms after surgery, with reduced pain and better mobility. However, there may be ongoing precautions to ensure spine health. When to consider surgery: surgery is typically considered if pain and symptoms are severe and not relieved by non-surgical treatments. There is significant weakness, numbness, or loss of function in the limbs. There is evidence of nerve compression causing permanent damage, e.g., cauda equina syndrome. Conclusion: herniated disc surgery can provide relief when conservative treatments fail, but the decision should be made in consultation with a spine specialist. It's important to understand the type of surgery, the associated risks, and the recovery process to make an informed choice.